Hello, everyone, and welcome back to your daily dose of English, where learning English is easy, practical, and super fun. I'm Tom.
And I'm Sarah. Hey Tom, how are you feeling today?
Honestly, Sarah, I'm doing great now, but last week, not so much. I had the worst toothache.
Oh no, a toothache. That sounds painful. What happened?
I had to go to the dentist, and you know what? It made me think this is the perfect topic for our listeners today. Because going to the dentist when you're in an English-speaking country can be really stressful if you don't know the right words.
That's so true. I remember my first dental appointment in English. I was so nervous. I didn't know how to explain what was wrong.
Exactly. So today we're going to help everyone feel confident about going to the dentist. We'll learn how to make an appointment, how to describe tooth pain, and how to understand what the dentist is saying during procedures.
This is going to be super useful. But before we start, we have a small favour to ask all of you amazing listeners.
That's right. If you're enjoying this podcast, please hit that subscribe button and give us a like. It really helps us continue making these episodes for you.
And leave a comment below telling us what country you're watching from. We love hearing from you.
Okay, Sarah, let's start with the basics. Imagine you have a toothache and you need to call the dentist's office. What's the first thing you need to say?
Well, the first thing is to introduce yourself and explain why you're calling. You could say something like, "Hi, I'd like to make an appointment with the dentist, please."
Perfect. That's very polite and clear. Or you could say, "Hello, I need to schedule a dental appointment." The word schedule means to plan or arrange a time for something.
Right. And if it's your first time at that dentist's office, you should mention that. You can say, "This is my first time at your clinic," or "I'm a new patient."
Good point. The receptionist will probably ask you some questions. They might say, "What's the reason for your visit?" or "What seems to be the problem?"
And this is where you need to describe what's wrong. Let's say you have a toothache. The most simple way to say it is, "I have a toothache."
Yes, nice and simple. Toothache is one word, Toothache. It means pain in your tooth. You can also be more specific and say, "I have pain in my back tooth," or "My front tooth hurts."
Exactly. And if the pain is really bad, you can emphasize it. You could say, "I have a severe toothache," or "The pain is really intense."
The word severe means very serious or bad, and intense means very strong. These words help the dentist understand that your situation is urgent.
What if you have other problems, like a broken tooth?
Good question. If your tooth broke, you can say, "I chipped a tooth," or "I broke my tooth." The word chip means a small piece broke off.
And what if your tooth fell out completely? That sounds scary.
It is scary. If that happens, you say, "I lost a tooth," or "My tooth fell out." And if it happened because of an accident, you should definitely mention that. You can say, "I had an accident and my tooth fell out."
The receptionist will probably want to know when the problem started. They might ask, "When did this start?" Or, "How long have you had this pain?"
Right. And you can answer with time expressions like it started yesterday, or "I've had this pain for 3 days," or "It started this morning."
What if you need an appointment urgently? Like, "The pain is unbearable."
Then you should say, "This is an emergency." or I need to see the dentist as soon as possible. You can also say, do you have any appointments available today? The word available means free or open.
And if they can't see you immediately, they might say, the earliest appointment we have is next Tuesday at 2 p.m. Earliest means the soonest or first available time.
Exactly. And then you can accept by saying, that works for me, or yes, I'll take that appointment, please.
Okay, Tom, now let's talk about when you actually arrive at the dentist's office. What happens next?
Well, the receptionist will greet you and probably ask you to fill out some forms. They might say, please fill out this patient information form, or we need you to complete this paperwork.
And you'll need to write things like your name, address, phone number, date of birth, and medical history. Medical history means information about your health and any health problems you've had in the past.
Right. And they might ask specific questions like, are you allergic to any medications? An allergy is when your body has a bad reaction to something. If you have allergies, it's really important to tell them.
Yes, very important. After the paperwork, you'll wait in the waiting room until the dentist is ready to see you. They might call your name and say, Tom, the dentist will see you now, or Sarah, please follow me.
Then you go into the treatment room. This is the room where the dentist will examine you and do any procedures. Examine means to look at something carefully to check its condition.
The dentist will usually start with a friendly greeting and then ask, what brings you in today? This is a casual way of asking what the problem is.
And this is your chance to explain your symptoms again. A symptom is a sign that something is wrong. You might say, I've been having sharp pain in my lower left tooth, or my tooth is sensitive to hot and cold.
Oh, sensitive is a great word. It means your tooth reacts or hurts when it touches something hot or cold. This is a very common problem.
Very common. You could also say, my gums are swollen, or my gums bleed when I brush my teeth. The gums are the pink parts of your mouth around your teeth.
What if there's something stuck between your teeth?
You can say, I think there's something stuck between my teeth, or food keeps getting caught between my teeth.
Okay, so after you describe the problem, what does the dentist do?
The dentist will probably say, okay, let me take a look. Then they'll ask you to open wide, which means open your mouth as wide as you can. They might also say, ah.
And they'll use some tools to check your teeth. They might use a small mirror and a pointed tool to gently tap your teeth and check for problems.
Exactly. During the examination, the dentist might say things like, does this hurt? Or, tell me if you feel any pain. And you should respond honestly. You can say, yes, that hurts, or no, I don't feel anything.
What if the dentist finds a cavity? What's a cavity?
Great question. A cavity is a hole in your tooth caused by decay. Decay means the tooth is damaged or rotting. When you eat sugar and don't brush properly, bacteria in your mouth create acid that damages the tooth.
So basically, a cavity is like a tiny hole in your tooth that needs to be fixed.
Exactly. If you have a cavity, the dentist might say, you have a cavity that needs to be filled, or you need a filling. A filling is when the dentist puts material into the cavity to fill the hole and restore the tooth.
What does that procedure involve? I know some people are scared of fillings.
It's not as scary as people think. First, the dentist will probably give you a local anaesthetic This is a shot or injection that makes the area numb so you don't feel pain. They might say, I'm going to numb the area now, or you'll feel a small pinch.
And numb means you can't feel anything in that area. Your mouth will feel strange, like it's asleep.
Yes, exactly. After the area is numb, the dentist will remove the decayed part of the tooth using a drill. They might say, you'll hear some noise, but you won't feel any pain.
The drill does make noise, but remember, you're numb, so it doesn't hurt. Then the dentist cleans the area and fills it with a special material.
Right. And the whole thing usually takes about 30 to 45 minutes. After that, the dentist will probably say, all done, or we're finished.
What if the problem is more serious? Like, what if you need a root canal? That sounds scary.
A root canal sounds scary, but it's actually a procedure that saves your tooth. Inside each tooth is soft tissue called the pulp, which contains nerves and blood vessels. When the pulp gets infected or damaged, you need a root canal.
So what happens during a root canal?
The dentist removes the infected pulp, cleans inside the tooth, and then seals it. They might say, the infection has reached the pulp, so we need to do a root canal, or we need to clean out the infection and save the tooth.
And I've heard that nowadays, with modern anaesthetics, a root canal isn't as painful as people think.
That's absolutely right. Most people say it's not much worse than getting a filling. The pain you feel before the root canal is usually worse than the procedure itself.
What about tooth extraction? That means removing a tooth completely, right?
Yes, extraction means pulling out or removing. Sometimes a tooth is too damaged to save, or you might need to remove wisdom teeth. The dentist might say, this tooth can't be saved, so we'll need to extract it, or your wisdom teeth need to come out.
Wisdom teeth are the teeth at the very back of your mouth that usually come in when you're a teenager or young adult. A lot of people need to have them removed.
Right. After an extraction, the dentist will give you instructions for care. They might say, bite down on this gauze for 30 minutes. Or, don't drink through a straw for 24 hours.
Gauze is a soft medical cloth that helps stop bleeding. And it's important to follow all the aftercare instructions.
Very important. The dentist might also say, take these pain medications if you need them, or ice your cheek to reduce swelling. Swelling means the area gets bigger or puffed up.
Let's talk about cleaning. What about when you go to the dentist just for a regular checkup and cleaning?
A regular checkup is called a dental cleaning or teeth cleaning. The dentist or dental hygienist will clean your teeth professionally. A hygienist is a person trained to clean teeth and help maintain dental health.
During a cleaning, they'll remove plaque and tartar. These are build-ups on your teeth. Plaque is soft and sticky, and tartar is hard.
They use special tools to scrape these build-ups off. Then they polish your teeth to make them smooth and shiny. They might say, I'm going to clean your teeth now, or this might feel a bit uncomfortable, but it shouldn't hurt.
And at the end, they usually ask, do you floss regularly? Flossing is when you use a thin string to clean between your teeth.
Yes, and be honest, if you don't floss, they can give you tips on how to do it better. They might say, you should floss at least once a day, or let me show you the proper flossing technique.
What about x-rays? Sometimes the dentist needs to take x-rays, right?
Yes, X-rays are pictures of your teeth and jawbones. They help the dentist see problems that aren't visible on the surface. The dentist might say, "Q, we need to take some X-rays," or "Let's get some images of your teeth."
And they'll put a heavy apron on you to protect your body from radiation. They might say, "I'm going to place this lead apron on you," or "Bite down on this and hold still."
The process is quick and painless. You just need to stay very still for a few seconds while they take the picture.
Okay, Tom, let's talk about questions you might want to ask the dentist. What are some important questions?
Well, if you don't understand something, you should always ask, "Can you explain that again?" Or, "What does that mean?" Don't be shy. It's your health, and you have the right to understand everything.
Absolutely. You could also ask, "How much will this cost?" Or, "Does my insurance cover this?" Insurance is when you pay a company monthly, so they help pay for medical or dental costs.
You might want to ask, "Do I need to come back for a follow-up?" A follow-up is another appointment to check how things are healing or to continue treatment.
Or you could ask, "What should I do if the pain gets worse?" Or, "When can I eat normally again?"
These are all great questions. And here's one more important one. How can I prevent this from happening again? The dentist can give you advice on better oral hygiene.
Oral hygiene means keeping your mouth clean and healthy. This includes brushing your teeth twice a day, flossing, and using mouthwash.
Exactly. The dentist might recommend brush for at least 2 minutes twice a day, or make sure to brush your back teeth well.
They might also say, "Cut down on sugary foods and drinks," or "Visit the dentist every 6 months for a checkup."
These are all important habits for keeping your teeth healthy. Prevention is always better than treatment.
So true. Okay, let's talk about some common phrases you'll hear at the dentist's office. Tom, can you start?
Sure, you might hear, "Rinse your mouth out." This means to put water in your mouth, swish it around and spit it out. There's usually a small sink next to the dental chair.
Right. And they might say, "Tilt your head back," or "Turn your head to the left." These are directions about how to position yourself.
The dentist might say, "You're doing great," or "Almost done," to encourage you and let you know how much longer the procedure will take.
If they need you to hold still, they'll say, "Try not to move," or "Stay still for just a moment."
And at the end, they usually say, "That's it. All finished." Or, "You did great, we're all done."
Before you leave, the receptionist will probably say, "Let's schedule your next appointment," or "We'd like to see you again in 6 months."
And you'll pay at the front desk. They might ask, "How would you like to pay?" And you can say, "I'll pay with my credit card," or "I'll use my insurance."
Tom, can we talk about some common worries people have about the dentist? I think this is important.
Absolutely. A lot of people are afraid of the dentist. This fear is called dental anxiety. If you're nervous, you can tell the dentist. You can say, "I'm a bit nervous," or "I'm scared of dental procedures."
Most dentists are very understanding. They might say, "Don't worry, I'll explain everything before I do it," or "Let me know if you need a break at any time."
You can also arrange a signal with your dentist. For example, raise your hand if you need them to stop. The dentist might say, "If you need me to stop, just raise your hand."
That's a great way to feel more in control. And remember, modern dentistry is much better than it used to be. Pain management is really good now.
Yes, and the benefits of going to the dentist far outweigh the temporary discomfort. Healthy teeth are so important for your overall health.
They really are. And going regularly for checkups means problems get caught early when they're easier and cheaper to fix.
Exactly. So don't put it off. If you have tooth pain or haven't been to the dentist in a long time, make that appointment.
Before we finish, let's do a quick role play. Tom, you be the patient, and I'll be the dentist.
Okay, great. Hi, doctor. I'm here for my appointment.
Hello, Tom. Nice to see you. What brings you in today?
I've been having some pain in my upper right tooth. It's especially sensitive to cold drinks.
I see. How long have you been experiencing this pain?
About a week now. It's getting worse.
Okay, let's take a look. Please open wide. Does this hurt when I tap on it?
Yes, that's tender.
All right. It looks like you have a cavity that needs to be filled. I'll need to numb the area first. You'll feel a small pinch, but then you won't feel any pain during the procedure.
Okay, how long will it take?
About 30 minutes, and we'll schedule a cleaning for next month to keep the rest of your teeth healthy.
Sounds good. Thank you, doctor.
Great role play, Tom. That's exactly how a typical appointment might go.
Thanks, Sarah. I hope that helps our listeners feel more confident about going to the dentist.
I think it will. And remember, everyone, taking care of your teeth is taking care of your health. Don't be afraid to go to the dentist.
And don't be afraid to speak English at the dentist. Now you have all the vocabulary and phrases you need.
You really do. You can describe your symptoms, understand what the dentist is saying, and ask questions.
And that's what learning English is all about. Being able to communicate in real-life situations.
Exactly. So practice these phrases. Maybe even practice in the mirror. The more you practice, the more confident you'll feel.
Great advice, Sarah. Okay, everyone, that's all the time we have for today's episode. We hope you found this useful.
If you enjoyed this episode, please give us a like and subscribe to your daily dose of English. We have so many more practical topics coming your way.
And leave us a comment below. Tell us, have you ever been to the dentist in an English-speaking country? What was your experience? We'd love to hear from you.
Thanks so much for listening, everyone. Keep practicing your English every day.
And remember, every little step counts. We'll see you in the next episode.
Until then, take care of your teeth and take care of your English.
Bye, everyone.
Bye for now.